Borderline personality disorder is one of the most misunderstood mental illnesses that is out there. It's a really complex personality disorder. It's really difficult to get a diagnosis, and the name itself is so confusing. Borderline personality disorder doesn't really tell you anything about what it's like to experience the disorder and what the symptoms are like and how to best get treatment. So in this video, what we're going to do is we're going to understand borderline personality disorder. Let's lay out a quick agenda for the video. The first thing that we're going to be looking at is what is BPD? That's the short form for borderline personality disorder, and what are the symptoms of borderline personality disorder. After that, we'll look at how do you get diagnosed with BPD, and then after that, we'll move into what is it like having BPD. And in this part, I'm going to share some of my personal experience because I've been diagnosed with BPD myself and have suffered from it for a really long time. And I also know a lot of people who have experienced BPD. I've read a lot about it, so I'm just going to be kind of giving my general personal experience with BPD and what people typically experience. Then we're going to dive into the treatment and outlook for BPD, and then the final kind of section, I'll give some personal tips and some clinical research on how you can manage BPD if you do suffer from it. So with that being said, let's dive into the first part of the video where we're going to be looking at what is BPD / what are the symptoms of BPD. So BPD is an extremely difficult disorder to kind of describe and to understand because it has a lot of different facets and aspects of it that all really need to be covered thoroughly in order to get a proper understanding of what exactly this disorder is. There's 9 different symptoms of BPD, which we're going to break down in a little bit, and you only need 5 of them in order to actually have BPD. This means that with the current criteria of borderline personality disorder, there are 256 different combinations of symptoms that could lead to a diagnosis. And this does make it challenging for people to actually diagnose you with borderline personality disorder. So what exactly are those 9 symptoms? We're going to go through each one, kind of describe what they exactly mean, what they look like in practice, and then we're going to get an overall picture of what BPD looks like before we move into the next section on diagnosis. The first symptom is frantic efforts to avoid real or imagined abandonment. So what this exactly means is that, like, let's say that, you like someone a lot. And you get some kind of inkling, some kind of hint that they're going to leave you. This isn't something that's like very obvious, This is something like they didn't reply to your text for 4 hours when they usually take 2 hours to respond. Something like this would send someone who has BPD to start spamming them with texts, or maybe calling their phone like 40 times in order to make sure that they are not going to leave them and to make sure that they're going to stick around. This can show up in your friendships as well, where you constantly need them to tell you that they're not going to leave you, that they do like you. You constantly think that people are going to hate you and that they're always going to leave. And if someone really does leave in your life, it causes a lot of problems. This can lead to you becoming extremely suicidal, extremely depressed. So this is a hallmark trait. BPD is kind of described as the crazy ex-girlfriend disorder, which I kind of hate that label, but the stereotype of that crazy ex-girlfriend is kind of what BPD really is. It's that person who's extremely obsessive, who will go to any end in order to stop you from leaving and desperately wants you to stick around no matter what. And it's not really their fault, as we'll kind of dive into as we understand BPD a little more as the video goes on. The second thing is a pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation. So again, this ties back to that kind of relationship struggles. If you're constantly afraid that people are going to leave you, you're going to be having unstable relationships. You can't have a healthy relationship when you're constantly afraid your partner is going to leave you. But there's an important piece here, which is that idealization and devaluation. This is what's called splitting in BPD, where what you do is one moment you'll think someone is the best person in the world, you'll think they're absolutely amazing, and you'll be head over heels in love with them. And then the other moment, you'll find yourself completely hating them, wishing they didn't exist. And these kind of switches will happen over the smallest of things, them not noticing an outfit that you're wearing on a certain day, them not laughing at a joke that you made. Small things can completely tip the balance on how you feel about someone. And this is what causes these extreme relationships that are extremely unstable, is that you'll have someone who is super hot or super cold, constantly going back and forth all the time, and this will confuse the person that you're with. You'll either be extremely into them, or you'll start a fight out of nowhere, or just become withdrawn and extremely emotionally cold. And this is where that instability comes in, because this leads to lots of relationships ending, or lots of relationships being on and off again, because you'll devalue and then idolize the person and want to be with them, but then absolutely not want to be with them. The third symptom is identity disturbance, markedly and persistently unstable self-image or sense of self. So this one is a little bit complicated complicated to explain, but the way you can kind of think of it is that people with BPD never really know what they want out of life. They feel really uncertain about who they are, and who they are dramatically changes depending on who they're with. Now, this happens to everyone. Everyone's a little different depending on who they're around, but people with BPD will completely change their entire personality, their outlook on life, their values, depending on who it is that they like or who they're friends with. So a good example of this is like if you find yourself, whenever you're with a partner, you kind of become completely different, and you become completely like that partner, or completely like some friend or some romantic, crush that you may have. That's BPD kind of stuff. That's where, you're changing your core values, and people around you who've known you for a long time are like, hey, what's going on? Why are you so different all of a sudden? You never used to be like this. That's BPD kind of at work, and this identity disturbance. This kind of also leads people with BPD to not have sustainable employment, because they're never really sure what they want to do, and they're so not sure of who they are and what they want to do with their lives that they can't really pick one occupation. They just kind of do whatever their partner or whatever their favorite person, which we'll maybe talk about in this video, will do as well. The fourth symptom is impulsivity in at least two areas that are potentially self-damaging. For example, spending, sex, substance abuse, reckless driving, binge eating. And another important kind of thing to note is that typically these impulsive things are done in order to numb negative emotions. So for example, I know in my life with substance abuse, like that's something that'll really, really increase dramatically when I have intense negative emotions. The thing is, people with BPD, as we'll see in kind of some of the other symptoms, have really intense high emotions, higher than the normal. And so because of that, they want to cope with those emotions. For most people, when they get sad, it's like a 6 out of 10. For someone with BPD, it's a 10 out of 10 or 11 out of 10. That's their normal, So because of that, it's hard to deal with those emotions and function in day-to-day life. And it's hard to find coping mechanisms that work well. So because of that, they'll turn to these things that are very extreme, very difficult, and very damaging. But they do, in the short term, quickly numb those intense emotional responses, at least some of the time. And so if you find yourself kind of engaging in much heavier substance use than your friends, or you tend to, binge eat whenever something bad happens to you, or, you have reckless driving and stuff like that. Like I know I will, speed like insanely fast when I'm feeling upset or something like that. These could be signs that you are, suffering from this symptom of BPD. The fifth symptom is recurrent suicidal behavior, gestures, or threats, or self-mutilating behavior. So again, if you, do any kind of self-harm, or if you struggle with suicidal ideation, honestly, with BPD, you kind of always have suicide on your mind. It's like something that's constantly there, ever present in the background. And it's a very, very common trait. Although you don't have to have it in order to have BPD, it is something you'll think about a lot. The sixth symptom is affective instability due to a marked reactivity of mood. For example, intense episodic dysphoria, irritability, or anxiety, usually lasting a few hours and only rarely more than a few days. So again, to break this quote down, basically just means you have intense mood swings, and they typically last just a few hours rather than a few days. So this is where BPD kind of overlaps with bipolar disorder, as we'll discuss a little bit later in the video, because you have these huge swings in mood. But with bipolar disorder, they last for multiple days. People with bipolar will have like 4-day mood swings, 7-day mood swings, 2-week mood swings, maybe even several months long of a mood swing. But people with BPD will have a mood swing that'll last like an hour or so. And then it'll kind of, go back to a completely different mood. So to kind of differentiate between BPD and normal mood swings is like with BPD, your mood swings are insane. You'll go from being suicidal, depressed, and like hating your life to being super happy and overjoyed within the span of a few hours. Like it is extreme mood swings that are very non-characteristic of most individuals. The seventh symptom is chronic feelings of emptiness. So this can also be felt as a kind of constant boredom. This can be felt as a loneliness, or a deep sadness that's kind of deep inside of you. A way that, I've seen people describe it online is this feeling of always wanting to go home no matter where you are. Even if you're at home, you always feel like, oh, I wish I was home right now. And that is that feeling of emptiness inside. This can be kind of a physical sensation that a lot of people will feel. I know I have a physical sensation of emptiness sometimes. And this really just kind of is an undercurrent of boredom, and you just like can't get stimulated out of anything. You can't get excited for anything. It's an extremely difficult symptom to deal with, and a lot of times it's substance use, or reckless driving, or binge eating, or spending, or reckless sex. All of these things give you a kind of adrenaline rush that'll override that sense of emptiness. So the next symptom is inappropriate, intense anger, or difficulty controlling anger. For example, frequent displays of temper, constant anger, recurrent physical fights. So this again, with the physical fights, this tends to be more of a male BPD symptom, but again, women can also engage in this. But again, anger outbursts are extremely common with people with BPD. They'll lash out at people out of nowhere. And again, this kind of goes back to that idea of splitting with idolizing and then devaluing someone. If you kind kind of start devaluating them and like split and become very angry at them out of nowhere, you'll have a huge anger outburst on them. So this is another very common symptom of BPD. So symptom number 9 is the final symptom, which is transient stress-related paranoid ideation or severe dissociative symptoms. So this is super confusing when it's worded like that, but basically what it breaks down to is that like you'll have some kind of like, paranoid symptoms. Like it looks kind of like paranoid schizophrenia. Like some people, when they're under extreme emotional stress, like hear, voices telling them to do things or something like that, but it's only under periods of extreme stress. It's not kind of out of nowhere. And these symptoms go away once the stress is relieved. Or more commonly, you'll have things like derealization or depersonalization, where you feel like, nothing is real, you feel like you're in a dream, everything feels fake. Or you'll have depersonalization, where you feel like you're watching yourself as if it's kind of a movie. And again, this happens under periods of extreme stress. So out of all of these, you need 5 symptoms in order to get the diagnosis. So how exactly do you get the diagnosis? Let's kind of go ahead and move into that. So there's a good article that kind of sums it up really well. It says, I quote, "A licensed mental health professional such as a psychiatrist, psychologist, or a clinical social worker can diagnose borderline personality disorder based on a thorough evaluation of a person's symptoms, experiences, and family medical history," end quote. And another important thing to note as well that this article talks about is, I quote, "Occasionally people younger than 18 may be diagnosed with BPD if their symptoms are significant and last at least 1 year," end quote. So if you're below 18 and you feel like you might have BPD, the thing is that like being a teenager kind of just is having BPD in a sense. Like a lot of teenager symptoms overlap with BPD. So you need to have those symptoms for at least 1 year in order to rule out the fact that it's not just kind of, growing pains. Another question to ask is who exactly tends to get BPD? And when do you tend to get BPD? So BPD is fairly uncommon. It's prevalent in about 1% of the general population. However, I quote, "Women account for 70% of patients with this disorder in clinical settings, and the most common age at first presentation is in late adolescence," end quote. So this basically means that, if you're a woman, you're much more likely to get diagnosed with BPD, although this is controversial as, there's a lot of sexism when it comes to the diagnosis of this disorder. I'm a male with BPD. And another thing that you have to realize is the common age as well. The younger you are, the worse your BPD is going to be. But the biggest thing is with getting the diagnosis, there are several things you need to keep in mind. So one, is a quote from earlier about how there are 256 different possible, combinations that could lead to BPD, or that could lead you to get a BPD diagnosis. So people with BPD look very different. From person to person, BPD is extremely different, and this can make it challenging to actually get that diagnosis. Another big thing is that there's a deep-rooted stigma of the diagnosis of BPD within the healthcare setting. People have found that, I quote, "Patients with the diagnosis of BPD frequently feel their complaints are not taken as seriously and that they are more frequently negatively treated compared to individuals without this diagnosis," end quote. So this is something that is very true. There's a huge stigma around BPD. People think that BPD is untreatable, that it's a terrible disease, all this kind of stuff. And the thing is, this stigmatization within the healthcare industry leads to people with BPD self-stigmatizing themselves more and then having worse treatment outcomes. There's a good quote that summarizes this that says, I quote, "Individuals with this diagnosis commonly self-stigmatize, developing low self-esteem and feelings of helplessness. Patients describe being referred to as liars and manipulators and not feeling as human as others. When asked directly, individuals with BPD identify connections with others, a focus on their strengths, and the adaptation of a holistic view of patients' lives, seeing someone as human as helpful," end quote. So the thing is, like, if you do get a good healthcare provider, if they are sympathetic, if they do understand your struggles with BPD, you're in good hands, and we'll dive into the outlook for BPD, which is really good. However, one of the biggest problems is that there are a lot of people with that stigma, and if they don't treat you well, that's not your fault. Make sure you find someone who you feel comfortable with and who you feel treats you correctly. That is what is most important. Because the thing is, like, with your treatment of BPD, it also kind of affects the people around you as well. There's a good quote from this same paper that we've been kind of talking about that looks at caregivers of patients with BPD. And they found that, I quote, "Including not having concerns about these patients taken seriously, frustration in not being able to access resources, and encountering mental health clinicians with poor health literacy/understanding of BPD, caregivers have endorsed impaired well-being, interpersonal difficulties, anxiety and depression, secondary post-trauma symptoms, for example, after witnessing self-injurious behaviors, and have reported higher rates of grief and burden compared to caregivers for individuals with other serious mental illnesses. Qualitative studies also suggest caregivers often hope to be more involved in partnering with clinicians," end quote. So again, just to really reiterate and emphasize, if you don't like your clinician, if you don't like the person you're with, if you feel like they're not knowledgeable, you are not alone. That is a common thing that people with BPD deal with. BPD is a very stigmatized and difficult to understand illness. Make sure you find a good provider if you want to get properly diagnosed and properly treated. Another big thing to kind of be on the lookout for is many people with borderline personality are misdiagnosed with things like depression, PTSD, or bipolar disorder, because all three of these have lots of overlapping symptoms with BPD. So if you think you have BPD, make sure you bring it up to your healthcare provider. Make sure you say like, hey, I think I may suffer from BPD, because that can actually save you a lot of headache. One of the biggest things is, again, I'm going to use a quote from the study that really highlights the difficulty with getting a diagnosis, which is, I quote, "Validity of current criteria for BPD shares problems with other psychiatric disorders, namely the absence of biological markers, unclear elimination from other disorders, and a wide variety of combination of symptoms that could lead to heterogeneity. In primary care, half of these patients will be undiagnosed or undertreated," end quote. So again, getting a diagnosis of BPD is super hard because you are very likely to be underdiagnosed or undertreated because of how complex BPD is and how similar it is to other disorders. Make sure when you're going to your provider, if you want to get that good diagnosis that's accurate, be aware of all these kind of difficulties with getting a diagnosis, and then this will help you get a diagnosis when you actually do go talk to a licensed psychiatrist or psychologist. So in the next section, we're going to kind of dive into what is it like having BPD. And in this section, I'm going to really draw on my personal experience with it because I feel like that's the best way to talk about it, but I'm also just going to talk about things that I've seen online, stuff like that. And then we'll start diving into the treatment and the outlook for BPD. So in terms of having BPD, it kind of is a roller coaster. You know, your emotions are all over the place. Like one day I'll be feeling extremely happy, extremely elated. I'll feel like everything is going my way. And then the smallest of things will happen and I'll feel absolutely terrible. I just won't be able to deal with, common normal stressors that ordinarily, like I would be able to deal with no problem. I have huge swings in my productivity. Like I'll either be able to get everything done, very ahead of time and be like on top of everything, or I'll be like super depressed and not be able to, get anything done for days at a time. It adds a lot of unpredictability to your life, and it makes it really difficult to kind of cope with and manage things when you're constantly going all over the place. And another big thing that's really difficult with BPD is your relationships. For example, texting. Texting is a nightmare when you have BPD, because the thing is, the second someone doesn't respond to you, you assume that they hate you. Like each minute that passes by that someone you like, doesn't respond to you can drive you absolutely insane. And this is something that's taken me a super long time to actually understand. It's still something I struggle with to this day, even after years of therapy, after doing a lot of stuff. Like when I like someone and they're not texting me back immediately, or if they're taking a little bit to respond, this drives me absolutely nuts. Even though I know that this person has no reason to dislike me, my mind is convinced that that is definitely why. You also have a deep desperation for validation. You constantly need other people to tell you that you're doing a good job. You need them to be happy with you. And if people are nice to you around you, and if they're, complimenting you and saying good things about you, you feel really good about yourself. But the second that validation goes away, you feel absolutely terrible. You also constantly need some kind of romantic relationship in your life, or you need to have a crush on someone or something, or else you feel extremely just empty and hollow and terrible. And this is one of the hardest aspects of BPD, because relationships trigger most of your BPD symptoms, but when you're not in a relationship, you feel terrible. Like you feel extremely depressed, anhedonic, like all of this different stuff. So relationships are a big aspect of BPD. If you think you may have BPD, the biggest thing you want to look out for is like, are interpersonal interactions your biggest struggles? Like interacting with other people, is that where most of your stress comes from? If yes, then you may want to consider BPD. Of course, there's lots of other things that could lead to this, but that is a big one. Another big thing is like, you really just cannot understand that other people love you. It's extremely difficult for me to process fully that other people like me and that other people want to be there for me. I'm getting better at it now as I have, better and better social support and, better relationships with people and less toxic people in my life. I've gotten better at doing that, but it's super hard to understand that people will be there for you and that they do care about you, and that they don't have ill intentions towards you. This can damage a lot of relationships too. When you constantly think that people are out to get you, that people don't like you and stuff like that, it can be really hard to maintain friendships and family relationships and all that stuff. However, it is possible to overcome all of these things. So those are just some of the, kind of things that go into having BPD. Of course, there's stuff like constant suicidal ideation. You're going to be in outpatient and inpatient quite often, which means, you're admitted to a psych ward because you're deemed a danger to yourself or to others. It's found that, I quote, "It is a common presentation in both psychiatric and general practice, with accurately diagnosed cases seen in 10% of psychiatric outpatients and 20% of psychiatric inpatients and 6% of family medicine patients," end quote. And again, since this is 1% of the population, this is an extremely high rate, suggesting that people with BPD do tend to put themselves in extremely high risk scenarios. I was hospitalized myself once, and there are several other times where I should have been hospitalized, but because hospitalization is extremely, for me personally, it was really harmful. And I know that Marsha Linehan has kind of talked about in the past, I believe, don't quote me on this, but I believe she's also talked about how like hospitalization isn't the best thing in the world. It's very harmful for a lot of people because of the stigma around BPD. So those are the kind of negatives of BPD in terms of personal experience, but I will say there are lots of positives as well. One of the biggest positives is that you have a much higher level of empathy for other people. You can understand other people a lot better. You have a better understanding of like the world and how it works and everything like that. If I'm being honest, like I would much rather have BPD than not have BPD, because the thing is, like, when you have these extreme emotions, you have this intense passion and burning curiosity for everything. It can be used to your advantage, but the thing is, it's hard to cope with the negatives of BPD. So now that we understand kind of some of these, what the experience of BPD, what it's like getting a diagnosis, what are the symptoms, let's dive into the outlook for BPD. Do you have a good shot of recovering if you suffer from BPD? And the answer is actually yes. There's lots of studies on kind of what BPD looks like as people grow up, and they're very, very promising. I'm gonna read a quote that's super cool here. It says, I quote, "All told, 50% of the borderline patients studied achieved a recovery from borderline personality disorder, an outcome that required being symptomatically remitted and having good social and vocational functioning during the past 2 years. In contrast, 93% of borderline patients attained a symptomatic remission lasting 2 years, and 86% attained a sustained symptomatic remission that lasted 4 years. In terms of stability, 34% of borderline patients lost their recovery from BPD. A similar 30% had a symptomatic recurrence after a 2-year-long remission, but only 15% experienced a symptomatic recurrence after a sustained remission," end quote. So basically, to summarize kind of what that says here, there's another quote from the study that summarizes it really well. It says, I quote, "Taken together, the results of this study suggest that recovery from borderline personality disorder combining both symptomatic remission and good psychosocial functioning seems difficult for many borderline patients to attain. These results also suggest that a recovery, once attained, is relatively stable over time," end quote. So what this basically means is that, like, a lot of people recover from BPD. A lot of people are no longer suffering from BPD. However, the difficulty with BPD is attaining good social functioning. So like, you have a job, you have friends, and you're able to kind of survive well in day-to-day life compared to the average person. But there's still quite a bit of hope. 50% of people achieving like complete recovery. This is like not including any treatments or anything like that. This is just like if you put people out into the wild and see what happens. So there is a pretty decent outlook for borderline personality disorder. And the thing is, once you kind of get to the point where your symptoms don't bother you anymore, it seems very likely that you will not have a relapse. Again, with that 15% of people who kind of had their symptoms come back up after achieving a sustained remission. There's another study too that had really promising results. It found that, I quote, 75% of patients at a 15-year follow-up and 92% of patients at a 27-year follow-up no longer have the disorder, end quote. However, the biggest thing that you need to be wary of when it comes to BPD is actually suicide. Because people with BPD have a 10% lifetime rate of completed suicide. This is a rate over 50 times higher than the general population. So this is an extremely concerning statistic, and this is the biggest thing with BPD is honestly you just have to stay alive. That's really hard with this disorder and its intense mood swings and the dysphoria and all that stuff. So if you can stay alive, if you can just keep going forward, eventually your symptoms will get better without treatment too. Like, this is not saying you have to afford the super expensive treatment, but without treatment, your symptoms will get better if you just stay alive and keep going forward. So now let's dive into the final section, which is kind of my personal tips on how to deal with BPD and then clinical research on how to manage BPD. So there's not many studies on exercise in BPD, but I thought I'd throw this one up here. It was on ADHD, but it suggests that there might be some link to BPD. I found that exercise helps me personally, so throwing that out there. But the biggest kind of evidence-based therapies for DBT are, I quote, DBT, which is dialectical behavioral therapy, mentalization-based treatment, schema-focused therapy, transference-focused psychotherapy, and systems training for emotionally predictable and problem-solving steps. So these are all evidence-based therapies, and the kind of big one that is kind of the gold standard for treating BPD is DBT, which is dialectical behavioral therapy. I'm going to pop up a ton of skills that you can kind of go through at your own leisure. They're a little difficult to explain, but if you want to get a starting point with what exactly DBT is and what some of the skills are that you can use, I recommend looking at these skills. I'm going to pop up a list right here. So go through those skills, look at them, and I have a link in the description below as well that has like a website that has a ton of resources on DBT skills and has all of these skills on it. So DBT, I recommend you get professional treatment, and I'll do a separate video at some point covering DBT and DBT skills. However, in the last part of this video, what I'll kind of talk about is personal tips that I have dealing with borderline personality disorder myself throughout my life. So one thing, have a routine. Like the number one thing I'm going to say is like routine dramatically reduces the symptoms of BPD, at least for me personally, and I know for a lot of other people as well. Having something that you do at the same time every day can really drastically reduce your anxiety and make your life a lot more predictable and help you get away from the chaos and instability of BPD. The second thing is having goals or deadlines. Have some kind of goal that you're working towards, and have some kind of deadline that you need to hit it. Some stress is good stress. Don't push yourself to the point where your BPD symptoms are flaring up ridiculously, but try and push yourself a little bit. Focus on goals and deadlines that are important to you, not to anyone else, not to your partner, not to don't care about what other people think. Do something that you want to do each day. And a big thing, the third thing, is working on self-love and self-compassion. So this is a tricky topic, and this is something that could have its own whole 1 hour video. But one thing you can do is self-love meditation. So Headspace has those, self-compassion or self-love meditations. That's what I use personally. That's my favorite meditation app. No sponsorship or anything. But also you can just look up on YouTube, self-love or self-compassion meditations. And those have been extremely helpful for me, and they may work for you as well. Another thing you can do is just do one nice thing a day for yourself. The kind of way I like to think about it is like, people with BPD very often want a partner in their lives to complete them. But think about what your ideal partner is. What would they do for you? And then do that for yourself. So one of the things I like to do is do one nice thing a day for myself. I'd love it if my, potential partner would do something like that for me. So I'll do it just for myself. And that can help a lot with building self-compassion. And another thing you can do is write down one thing you like about yourself a day. Now, this can be hard when you get started, but it will kind of dramatically help you slowly boost your self-esteem. At least it did for me. The fourth thing is gratitude. Write down just 3 things you're grateful for every day. There's tons of research on gratitude. I'm going to put up a book here called Thanks, I believe, that's really goes over all the research on gratitude. Immensely helpful and can help you a lot, especially when you're feeling very down or very depressed. I know what it's like. I've been there, but gratitude does help you out during those times. It can be hard, but it's something essential and critical to your happiness and well-being. And the final thing I'll give, again, DBT. DBT is really helpful. Like DBT has made a night and day difference in my symptoms. Like my symptoms went from constantly going up, getting terrible and worse over the years, to like completely skyrocketing downward. So DBT is super helpful. If it doesn't help you, don't get discouraged. I've been at this for almost 7 years now, and I, still have lots of hiccups and difficulties. But if you just kind of keep going, push through it, things do get a lot better. And there's lots and lots of hope for you if you are struggling with BPD right now. So thank you so much for watching. I hope that this video helps. Have a good day and take care.